Hello everyone and welcome to today's webinar. My name's Liana Danby and I will be presenting the webinar this morning. Before we get started, I would like to go over a few items so you know how to participate in today's event. You may have joined the presentation listening using your computer speaker system by default. If you would prefer to join over the telephone, just select phone call in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. There are some handouts available for you to download during the live broadcast. If you would like to download them, then please locate them from the handout section of the control panel. It's my pleasure to introduce your first speaker, Jamie Munro. Jamie, over to you.
Thanks, Liana. Can we have the next slide, please? That's great. Okay, so thanks to everyone in attendance for today's webinar. My name is Jamie Munro. I'm the Sales Manager for Pentland Medical. Also joining me today is Heidi Neilsen. Heidi, could you please introduce yourself to the audience?
Hello, my name is Heidi Neilsen. I'm the clinical specialist at Furine with a background in nursing, and I'm very pleased to be here. I've looked very much forward to this webinar today.
Thanks, Heidi. And in today's webinar, we're going to discuss the problems related to fecal incontinence in the ICU environment and introduce you to our new solution for management of fecal incontinence. I'm going to run through a short presentation before we play a pre-recorded video where Heidi goes into detail on the Furine External Catheter. We will have some discussion between ourselves before we play a testimonial video, and we'll be taking live questions from the audience at the end. So please do submit your questions throughout today's webinar. Finally, we do have a special offer a little later on in today's webinar, so please stay tuned for more information. Next slide, please. Acute fecal incontinence with diarrhea is an unfortunate circumstance in the intensive care unit. It's thought to affect roughly 40 to 50% of patients coming into the ICU and presents a difficult problem for the ICU nursing team to manage on top of the potential complications that can arise from it. There is currently no standardised method of dealing with fecal incontinence, and every patient coming into the ICU presents different circumstances, which requires a variety of products and methods to deal with specific problems. Next slide, please. Clinical challenges of AFID include the risk of perineal skin breakdown and cross-contamination with infections such as C. diff. Other possible complications include abdominal distention, vomiting, dehydration, confusion, retention of urine, overflow of faeces and obstruction, and even perforation of the bowel, all of which can be dangerous to the critically ill patient and at the very least likely to lead to increased hospital stay and the associated costs. Within the high-tech environment of the modern ICU, bowel care has often been overlooked, and the primary priority in the ICU is to save lives, but it can lead to many problems if not dealt with in an effective manner. So we're now going to play a video featuring our very own Heidi Neilsen. In this video, Heidi will explain the current methods of dealing with fecal incontinence in the ICU before demonstrating the brand new Furine External Faecal Catheter. So if we could play that video, please.
Hello, and welcome to this training session concerning Furine's External Faecal Catheter. I'd like to start by introducing myself. My name is Heidi. I'm a nurse. I've worked in the Danish healthcare system for the past more than 20 years. And today I'd like to introduce to you this new external fecal catheter system. Fecal oozing is the problem that many critically ill patients face. And it's a problem that needs to be addressed because with fecal oozing, there's a risk of skin complications. There's the risk of skin breakdown, of sores, of infections, and so on. Fecal oozing is also a problem that can be very time-consuming and challenging for the nurse. Today on the market, there are two main categories of solutions that are used. There's the invasive catheter system, which is a catheter that is placed inside the rectum of the patient, and then a balloon is filled with air to ensure that the catheter stays in place. And the fecal matter is led through a tube into a bag that's on the bedside. And this is a really good system because it solves the problem. The only thing is that it's a very expensive system, and it's also, for many patients, very uncomfortable. It can even be painful. The other main solution is an ostomy bag or a fecal collection bag that is placed directly on the perianal skin. This is also a good solution in many ways because it's cheap. The problem is that the patients lie directly on the bag in the bed. And also the adhesive system is a hydrocolloid system, which can be very hard for the patient's skin. Furine's external fecal catheter is placed in between these two systems. It's not an invasive catheter, it's non-invasive, but it's still a catheter system that leads the fecal matter away from the patient and into a bedside bag. But it's not like an ostomy bag or the fecal collection bag system, which is placed directly on the skin and contains the fecal matter there. But it is a system that is non-invasive, so it's attached to the perianal skin, like an ostomy bag is. The main difference is that the external fecal catheter system is made of silicone. It's entirely a silicone-based adhesive system that is very soft and very pliable and very comfortable for the patients. I can show you a flange, which is the part that is attached to the patient's skin. As you can see, it's very soft and it's elastic and pliable, so it conforms to the anatomy of the patient's body. You can try to feel it yourself.
Wow, it's very soft.
It's very soft, and the patients that have given feedback on the system says that it's very comfortable to wear. There's no discomfort in wearing this system, so that's a really good thing about it. So I'd like to introduce to you to the external fecal catheter itself. An external fecal catheter kit comes in a box like this, which contains everything that's needed to start up a patient for using the catheter. Inside a box, you have the external fecal catheter. As you can see here, this is the flange that I showed you before. There is an adhesive barrier film. There are some medical skin wipes. And there is a fecal collection bag, which looks like this. And of course, instructions for use. When you decide to use a fecal management system, the important thing is to assess the patient's skin. The patient's skin, in order to have an adhesive system to be attached to the skin needs to be completely dry and intact. If the skin is moist for any reason, for example, if it's macerated or if there are sores in the perianal area, then the skin will be moist and adhesive will not stick to a moist surface. So in order for this system to work, or any other adhesive system to work, the skin needs to be completely dry and intact and clean, of course. So once you've assessed the patient's skin, it's important that any excess oil or fat is removed from the skin. Often when you wash a patient, in the cleaning solutions that you use, there's often added a little bit of oil to moisture the skin, and that's usually a really good thing, but when it comes to adhesive systems, then it's not a good thing. So you need to remove any excess oil from the skin, and that is done by using a medical skin wipe. So I'll just demonstrate on my own skin, on my arm. You simply prepare the skin, the clean and intact skin, you prepare it by wiping it off with a medical skin wipe in order to remove any excess oil or fat from the skin. And once you've done that, then the skin is ready to receive the catheter. And the first thing you do is to apply the adhesive barrier film. Which looks like this. The adhesive barrier film is part of the adhesive system. There's the flange, which is one part of the adhesive system, and then there's the barrier film, which is the other part of the adhesive system that causes the catheter to be firmly attached to the skin. But another feature of the adhesive barrier film is that it's a film. So when you apply it to the skin, you create a barrier film that protects the skin during use of the catheter. And that's important to know that this film itself protects the skin. So you mustn't use other barrier films that you normally would use on the skin, because you can't mix this one with another barrier film. So this is the protection of the skin while you use the catheter system. And what you do is you simply take the skin, the swab, and then you apply it to the skin in the perianal area, in the whole circumference. And it needs to be in the same width as the flange to receive the flange when you apply the catheter. So once you've applied the adhesive barrier film to the skin, it needs to dry. An important thing to know is that the adhesive barrier film sticks very well to itself. So the buttocks need to be kept apart. And for that reason, you need to be 2 nurses while applying a catheter. One nurse to hold the patient and the other nurse to apply the barrier film and to apply the catheter system. And it takes approximately 1 minute for the adhesive barrier film to dry. So in that time, you simply have to wait until the film is dry. And often you can see when it's dry. Here it's dry, and once it's dry, you can touch it without becoming wet on your hand. And once it's dry, it's ready to receive the catheter. So the catheter itself has a 1.5 meter long silicone tube. And it's fixed to an applicator, which you can see here, the blue applicator. And the applicator enables me to have a good firm grip on the catheter while I apply it. So I simply hold onto the applicator and hold onto the wings of the flange with my fingers, and that causes me to have a really good grip on the catheter and enables me to put a good firm pressure while I apply it. So I simply apply it with a good firm pressure, especially in crania ani and perineum, which are the areas where it usually is difficult to get something to stick securely. And then with my fingers, I put pressure on the flange and press it onto the adhesive barrier film that I've applied. And once I've done that, I can remove the applicator and again put pressure on the whole circumference of the flange. And once I've done that, it's on. It immediately sticks. As you can see, I can pull very hard. It won't come off. The bond is immediate, and it's a really firm, good grip that is between the flange and the barrier film. So once it's on, you'll want to apply the bag to the other end of the catheter. And the bag looks like this. It's made of a non-see-through material in order to be discreet and to protect the integrity of the patient. On the other side, you can observe the contents of the bag. There's a window, and you can measure what's in it, and you can observe it. And it can contain 1 liter. There's also a charcoal filter, which enables air to escape from the bag without the odor. And it's very easy and simple. You simply place it on the outlet of the tube, and then you put the hooks into the holes in the bag, like this. And once you've done that, it has a good, secure, firm grip. It won't fall off. It's very strong. Also, there's a bed hanger, as you can see here. And the bed hanger has a secure locking mechanism. You can open it like this, then you can put it onto the bedside and close it. And it has a secure locking mechanism that enables the bag to hang on the bed without any fear of it falling off. So no accidents will happen. So once that's done, it's stuck, it's on, and it works. The catheter can be applied and sit on the patient for approximately 5 days. We recommend that you change the catheter system every 5 days. Sometimes, on a few patients, you can sometimes experience leakages. And if there is a leakage, if for example, there's a channel that has developed in the flange, you can sometimes repair it by using some added adhesive barrier film, and you can cause it to become secure again. So that's how you apply the catheter. And of course, at one point you need to remove it again. And if I just pull this off now, you can see because it's stuck so well, it will be hard for the skin. But it's actually possible to remove the catheter system in a very gentle and skin-friendly way, where there's no pain for the patient at all. And here, the medical skin wipe again is the solution, because the liquid in the medical skin wipe dissolves the adhesive barrier film. So what I do is I simply take the medical skin wipe, and then I allow the liquid to do the work. I can pull in the wing of the flange here, and then I can just wipe with a medical skin wipe very gently. I don't have to use any force or pressure. I just wipe with the skin wipe. Usually when I have 2 hands, that makes it a little bit easier. But as you can see, it's already almost halfway off. So it's very easy by using the medical skin wipe to dissolve the adhesive, and in that way remove the catheter. So that's how it works. So, do you have any questions?
Yes, actually. What if the patient has a lot of hair in the anal area? Do I shave it off, or what do I do?
That's a good question, because many patients actually do have a lot of hair in the perianal area. And I'd say if you can avoid shaving the patient, don't do that. Because when you shave the patient's skin, you affect the outer layer of the skin. You destroy the outer cells on the skin, and it causes the skin to become more moist. So that's not a good thing. So I would actually, if the patient has a little or a moderate amount of hair, I would simply apply the adhesive barrier film onto the hair. And it may take a little longer for it to dry, but once it's dry, the flange will stick and it will be secure. If there's a lot of hair and it needs to be removed, instead of shaving, I would simply cut it with a pair of scissors and then apply the adhesive barrier film after that. But I'd never shave the skin. So, any other questions?
Can odor be a problem when using the catheter?
It can actually, because the catheter system is made of silicone, and that's because silicone is very skin friendly. But the disadvantage with silicone is that it's permeable for odor. So in some situations, absolutely not in all situations, but in some situations where odor is a big issue, then the odor will seep through the tube, and that can become a problem. But we have actually a solution for that, because we have a catheter system like this one, but with an extra layer on the tube, and we call it external fecal catheter with odor control, and that effectively reduces the odor that comes out.
Can I mobilize the patient to a chair while using the catheter?
Yes, absolutely. Because the silicone is so soft, it's possible for the patient to sit in a chair for an extended period of time. With the invasive catheters, there's a limitation of the amount of time a patient is allowed to sit up. But with our system, with the Furine External Faecal Catheter, because it's so soft and pliable, the patient is actually allowed to sit in a chair as much as needed. There are no time limitations for that.
Okay. Can I use other wipes than your medical skin wipes?
That's a good question, because the medical skin wipe is used for two things. It's used both to prepare the skin before application of the catheter, and it's also used when you remove the catheter. And other medical skin wipes on the market, they all have a little bit of added oil. And when you prepare the patient's skin, what you're doing is actually removing excess oil from the skin. So in that situation where you prepare the skin to receive the catheter, you need to use Furine's medical skin wipe. When you remove the catheter, the important thing to know is that you need to use a medical skin wipe that contains siloxane. Siloxane is the part of the medical skin wipe that dissolves the adhesive barrier film. So any medical skin wipe that has a siloxane, that is based on siloxane, can be used. Yes.
Okay, thank you.
So do you have any other questions?
No, I'm fine, thank you.
Okay, great. So purchase options. You can purchase the external fecal catheter as kits. So a catheter like this has everything that's needed, or kit like this has everything that's needed to start up a patient. But it's also possible to purchase extra bags. They come in boxes of 10. You can purchase extra medical skin wipes. They come in boxes of 30. And you can purchase extra adhesive barrier films, which comes in boxes of 5. And then, of course, you can purchase the external fecal catheter with odor control as well as a kit. If you want to have more information about our catheter system, you can visit our website at www.furine.com, where you can find all of our brochures and our instructions for use and so on. There's also a product video with an animation film that shows how to use the catheter, which is really good for the training of nurses and so on. So thank you very much for attending this training session.
Thank you.
Okay, sorry. Yeah, thank you for the video. So I'm now going to bring in Heidi to discuss some more background on the Furine External Faecal Catheter. So Heidi, thanks for joining us today. Can you give us a little bit of background on your work as an intensive care nurse and the issues you experienced firsthand relating to fecal incontinence?
Yes, as I mentioned, I'm a nurse, a trained nurse, and I have more than 20 years of experience from a variety of different wards in the Danish healthcare system. I've been in internal medicine and plastic surgery in the operating theatre, and of course also in the ICU. And even though it's some time ago that I worked as an ICU nurse, I have vivid recollections of dealing with the issue of fecal oozing and the challenges that we as nurses faced dealing with this issue. Back when I was an ICU nurse, we didn't have a lot of good solutions for the patients. It often ended up with patients with macerated skin and sores and pressure wounds in the perianal area and infections, as well as the pain and the discomfort that the patients experienced due to the fecal oozing. And of course, it was very time consuming for us as nurses to deal with this issue, along with the increased risk of the spread of bacteria and so on every time we had to clean a patient. We would try the fecal collection bag, which is the exact same type as is on the market today, which has a hydrocolloid adhesive system that needs to be warmed up before it will stick to the skin, and which needs to be cut with a pair of scissors in order to fit the patient's anatomy. But I never found that it was a good solution, because I found it difficult to get to stick to the skin properly, and also the drop-off rates was very high. And we also found actually that the hard hydrocolloid adhesive plates would sometimes leave pressure marks and even the early stages of pressure wounds on the patient in the perianal area. The invasive catheter system at that time was a new technology and very expensive, so we were seldom allowed to use it on the patients. That has changed now, however, because the prices has decreased. So in Denmark, before Furine's external fecal catheter came on the market, the invasive catheter system was, for most of the wards, the first choice of use for patients with fecal oozing. But today, many ICUs that are using the Furine system have chosen the external fecal catheter as their first choice of use. And there are several reasons for this. First of all, it's because it's non-invasive. And because it's non-invasive, the discomfort and sometimes even the pain for the patient is drastically reduced, and perhaps even eliminated in many cases. And the fact that it's non-invasive also means that the risk of damage to the sphincter muscle or the rectum is eliminated completely. Because it's non-invasive, and also because it's very soft and pliable, there's no time limitation for how long a patient is allowed to sit in a chair while wearing the catheter system. And so far, we haven't had any reports of pressure marks on the patients that have used Furine's external fecal catheter. Another reason that many Danish wards have chosen Furine external fecal catheter as the first choice of use is because of the cost. It's significantly less costly than an invasive catheter. And also it's very easy to apply because there's the blue applicator, which makes it easy to apply it correctly from the beginning.
Okay, that's great. Can you give us some insight into the development process of the Furine product? I mean, how did your experience as an ICU nurse and an in-depth knowledge of the issues we've discussed today, how did that feed into the concept of Furine?
Well, the background of the catheter, it actually goes right back to about 2010, where Brian Nielsen, who is the inventor of the catheter and also the managing director of Furine, worked with innovations within male urinary incontinence. And one idea led to another, and combined with his background in chemical engineering and product innovation and development within the field of wound care, he came up with the idea of an external solution for fecal oozing. Coincidentally, I'm married to Brian, so he would often discuss his ideas with me. And with my background in nursing, and specifically with my background as an ICU nurse, I could give him important insights into the challenges that nurses face in dealing with fecal oozing. And I must admit, when Brian first told me of his idea of making an externally fixed fecal catheter system, I didn't really believe that it would work, because I had all my bad experiences from trying to get the fecal collection bag to sit, and I remembered all the drop-offs and all the challenges we faced, so I really didn't believe in it. But of course, I was completely wrong. And the main difference is the silicone adhesive technology, which is very different from a hydrocolloid adhesive technology, which was the one I was accustomed to. And also the fact that part of the adhesive system, the adhesive barrier film, is smeared onto the skin before application of the catheter itself, causes a very good and strong grip between the catheter and the skin and reduces the risk of leakage. So in 2014, Furine was founded and development of the external fecal catheter began. And the product was launched in Denmark in 2019, as recently as that. And we've been introducing the product mainly to ICU wards in Denmark ever since. Today, the catheter is in use in about 80% of Danish ICU wards. And despite the COVID-19 situation, more and more Danish hospitals are coming on board. In terms of where Furine fits in the current landscape of fecal management systems, I'd say that the Furine's external fecal catheter is a really good alternative to the fecal collection bags, because it's a catheter system where the bag is attached to the bedside and isn't in the bed in close proximity to the patient. And also because of the adhesive system, it's soft and pliable, and at the same time it has a very strong bond to the skin. Furine's external fecal catheter is in many cases also a very good alternative to the invasive catheter system, because by using a non-invasive solution, a lot of risks for the patients are eliminated. And it's also significantly more comfortable for the patients and also a lot cheaper. But Furine's external fecal catheter cannot completely replace invasive catheters. There are some situations where the invasive catheter system is the only available solution and is the right choice for the patient. This could, for example, be for patients that have wounds in the perianal area or for patients with large external hemorrhoids. On the other hand, there are also situations where it's not possible to use an invasive solution. And then it's important to have a good non-invasive solution for these patients. This would, for example, be for patients that have had rectal surgery or patients with large internal hemorrhoids or diseases in the bowel and so on.
Excellent, thank you. And yeah, I did notice from the registrations from many of our audience members in today's webinar did say they were using the invasive solution. So it's an important point that it's not necessarily a replacement for that. It's just another option. As I mentioned in my presentation, the different patients present different circumstances, and it's good to just have a wide range of options. And obviously, if we can go non-invasive, that's always going to be preferred to an invasive solution. But obviously, as you mentioned, it's not always possible. So just another option there as well. So yeah, what have you learned in the early days of marketing the Furine range? I mean, how have current customers elsewhere in Europe, how have they welcomed the product, and how is it fitted into their daily workflows?
Well, I found that when a ward begins to use Furine, there's a period of time where the nurses, they get used to the new product. And you know, when you're used to doing something in one way and you're presented with a different way of addressing the same issue, this change can be a challenge. It can be difficult to change a habit. And so there's a period of adapting to a new way of doing things. I've also found that there's a learning curve when getting to know the catheter. And here the important thing, the very important thing to stress is to assess the patient's skin correctly from the onset. Because with fecal oozing, there's a window of opportunity where it's possible to use a non-invasive solution, a window of opportunity where the skin is still intact and a catheter, an adhesive system can be applied to the skin. If too much time passes after the onset of the fecal oozing, the skin will become red, macerated, and for that reason it will become moist. Even though it's only a little bit macerated, there will be extra moisture, and as we all know, it's extremely difficult to get any adhesive system to be attached to moist skin. So there's this window of opportunity where it's possible to attach the system. But many wards in Denmark have completely converted to using Furine's external fecal catheter as their first choice of use. And the feedback from these wards is that they're very happy for the product. And this is obviously also evident from sales. In Europe, there are several countries that are in the early stages of presenting the catheter in the hospitals. It was actually our goal to penetrate the European market in 2021, but because of the COVID-19 situation, this has been hampered to a large extent. But at the moment, several countries are introducing the product and doing trials, and there's also a couple of countries that have started to sell the product to wards in their countries, and we have positive feedback from this.
Excellent, thank you. So just a final question from me. Are there any future development plans for Furine? And if so, what are those plans?
There are always plans and a lot of ideas on the table. One thing that we're actually going to launch pretty soon is a medical adhesive remover spray, which will really aid in the removal of the catheter, especially for patients that have a lot of perianal hair. When you spray, when you use the spray, it's possible to completely remove the product in a completely pain-free way, and it's very effective. So we're really looking forward to launching that. This is going to be a very useful tool for the hospitals. So that's one plan that's coming up very soon. We're also, of course, all the time working on developing the product to become better and better, and we're working on an upgraded version of the catheter right now, where we expect that we're going to get the adhesion to the skin to become even stronger. So that will be at some point in the future. We'll have an upgraded version of the catheter itself.
Excellent. Okay, exciting times. So that's great. Thanks very much, Heidi. So we're now going to just play another video. This one, testimonial from some current users of Furine who will share their experiences of the product and how it's been beneficial to them. So if you could play that second video, please.
Hello, my name is Hannah. I've been a nurse for the last 26 years. The last 20 years I've worked at different ICUs, and I'm currently working at the ICU at Herlev Hospital, Copenhagen, Denmark. My ward has been using the Furine system for patients with fecal leakage for about 2 years now, and since the product was introduced to us, this has been my product of choice. The first reason is that it seems to stick to the skin better. I guess, it's because it has a better adhesive. The fact that it sticks to the skin longer protects the skin better in the long run, because we all know the more often we have to change a product with any adhesive, the more often we have to remove it and replace it, the more the skin is at risk of being denuded or stripped of its epidermis. It seems to stick so well that it lasts longer during mobilization as well, which is a really important thing, because we mobilize our patients into armchairs at least 2 times a day. So it's really important that the product sticks. Second reason I like the Furine is that the material is very soft and very flexible, and the lumen of the tube leading the output away from the patient is very wide, which means it can be used for mixed consistencies. The third reason I like the Furine is it seems to contain the smell better than many other products we have tried in our ward. The best feature of the Furine is its ability to stick to the patient and its soft and flexible material. The Furine system is very easy to apply. You can apply it after seeing it done once, and maybe you don't even need that.
Hi, my name is Maria. I'm an ICU nurse and have been that for 10 years now. Currently I'm working in Norway. I have been introduced for the Furine catheter 3 years ago, and I'm very happy to use it. It's my #1 choice before using an invasive catheter as FlexiSeal, because it's more gentle for the patient. And I think other similar products, non-invasive products, they lose the softness that the Furine catheter has. This blue pillow that is very soft, and it's very gentle for the patient's skin. It's very easy to apply. There is this little blue apply stick to help you apply it.
Okay, can we have the next slide, please? Okay, great. Yeah, moving on, but we're just about to start the live Q&A session where you can ask us anything about the issues we've discussed today and the Furine External Faecal Catheter. Before that, however, we'd like to make you aware of a special offer exclusive to audience members of this webinar. As per the info on the current slide, we are offering a free, fully supported trial of Furine up to the end of June if you quote the code Discover Furine. Additionally, we are offering a 20% discount on initial orders of Furine in the UK. So if you're interested, please do get in touch for more information. So next slide, Liana, and over to you to manage the questions that have been coming in.
Thank you, Jamie and Heidi. We're now going to begin answering the questions submitted during today's presentation. As a reminder, you can still submit questions through the questions pane in the attendee control panel. Our first question is, do you see a need for invasive catheters if Furine works so well, as you say it does?
Hand over to you for that one, Heidi.
Yes, the invasive catheter solution is a really good solution when, for example, when the skin is macerated or there are sores in the perianal area. Because if the skin is macerated or there are sores, then you won't be able to get an adhesive system to stick to the skin. So in those situations, an invasive catheter is the right choice.
Yeah, no, I think it's something we picked up on as well. You know, it's different patients, different circumstances, and this is just another option. And obviously the advantages of using a non-invasive system compared to an invasive one are quite clear. Additionally, there's you know, there's a cost saving to be made there of using Furine compared to the invasive catheter. So yeah, it's not necessarily about direct replacement. It's all about choosing the appropriate circumstances to use Furine and realizing the advantages you could get from that instead of using invasive all the time. I guess that's the best way to answer that, I think. Yeah, next, Liana.
Thank you very much, both of you. Another question that's come in, are there any contraindications for using Furine?
Yes, the main contraindication is if there's perianal wounds in the area, if the skin is moist and wet, because then you can't get it to stick. And also if there are large external hemorrhoids, that's also a contraindication. Concerning allergy, of course it's possible to be allergic to silicone. So if you're allergic to silicone, that would also be a contraindication, but it's extremely seldom. And we haven't had any reports of that as yet.
And yeah, I mean, not necessarily a contraindication, but again, just coming back to something you said during the presentation, Heidi, is it's all about identifying that window of opportunity to use Furine, because it's not, you know, it might just be like a couple of days or something before the skin goes so bad that it's not possible to use Furine. So again, it's all about identifying the appropriate circumstances to use Furine.
Thank you. How long will Furine catheter stay in place? What's the maximum time?
Yeah, it stays in place for, that's very different. For some patients it stays in place for 3 days perhaps, and for other patients it'll just keep on being in place for as long as you like. But we recommend that the catheter is changed every 5 days. Not because it's dangerous to keep the catheter after 5 days, but because it gives the nurse an opportunity just to check up on the skin.
Okay.
Thank you. Was there anything you wanted to add to that, Jamie? Or
no, I think Heidi covered it quite well. Yeah, thanks.
Perfect. So another question that's come in from Ross. Has there been any patients that have had a reaction to the adhesive?
No, not a reaction to the adhesive itself. We've had a case where when the system was removed in a wrong way, where they had used I think they had used a wipe that was dry and tried to wipe it with that, and that had caused a reaction. But there haven't been any reactions to the product itself so far.
Thank you. Another question, is the odor-free Furine also completely latex-free?
Yes. There's no latex. It's the tube, the silicone tube is covered with a polyethylene tube on the outside of the silicone tube, but it's completely latex free. Everything with our product is latex free. There's no latex anywhere.
Perfect. So I think there are a couple of questions coming in, kind of touching on when the catheter needs to be changed. So one that's come back through is there a need to change the catheter? How long do we have to wait to place a new Furine catheter? A couple of questions like this. So
I'd say that if you change the catheter and the patient still has fecal oozing, I would replace it immediately, simply to avoid maceration of the skin and so on. So that you don't have to remove the catheter and then wait for a period of time before applying the next one. You can just remove it, clean the skin, prepare the skin, and then apply a new catheter immediately.
And you would recommend doing that every 5 days anyway, Heidi, or is that?
Yeah, I would recommend that you do that as long as the patient has fecal oozing. I would recommend that you keep on using a catheter system. And that's also because when you use a collecting system, it's possible to measure the output, which is an important part of taking care of an ICU patient. And you're able to measure the output of the patient when you use a catheter system like Furine. So for that reason alone, it's a good idea to keep on using it, but also because it protects the patients. When you use a system that diverts the fecal matter, you protect the patient's skin and avoid a lot of other issues that may arise.
thank you. Again, still a couple of other questions coming in. So just to clarify, 5 days is the max that Furine should be on the patient before it's changed. Is that correct?
That's our recommendation.
Lovely, thank you. Another question's just come in. Are there any medical indications for removal of the catheter? Perhaps earlier than the 3 or 5 days, if anything was to occur to the patient's skin, or?
I'd say that if for example, if the patient seems to be getting an infection and you can't find out what the source of the infection is, I would look everywhere where it's possible that something is hidden. So I would remove plasters or other things on the body, and also the Furine system, simply to look underneath and see if there's a root of the cause there. That would be a reason, a medical reason to remove the catheter, just to check to see if there's a cause of an infection coming from that area.
Thank you. Lovely. Yes, no, sorry, that seems to be all of the questions answered that have come through.
And there is one from Raquel about sharing the studies about the 40% of ICU patients affected by
yes.
AFId. So yeah, I can share that information in the follow-up. So yeah, I'll be in touch. Thank you.
Perfect. Thank you both very much for answering all of today's questions, and thank you everyone for attending today's webinar. Once you leave today's webinar, you will receive a survey on the presentation, and we would really appreciate it if you would take the time to complete that and provide your feedback. You will also receive a follow-up email within 24 to 48 hours with a link to today's recording. On behalf of Pentland Medical and our presenters, thank you very much for joining today, and enjoy the rest of your day.
Thank you.
Thank you.